So, welcome to the Intern Whisperer. Our show is all about the future of work and innovation. And today's guest is Dr. Dan Pavlik Jr. from Pavlik Center for Health and Wellness. He has specialized training in whiplash trauma. That's how I met him, because I had that. From the Spine Research Institute of San Diego, as well as postdoctoral training in chiropractic management of sports injuries. Dr. Dan has treated many local professional sports leaders, and I know he can't say which ones here in Orlando, Florida, as well as working with local youth sports players. He has followed in his father's footsteps for this career, and they share this business together. So he's going to, I'm sure, talk about his dad. So welcome to the show.
Thank you for having me.
I'm very excited. I got to meet you because I also was in a car accident, and then I was working with Dr. J, and he went on vacay, and then I got to meet you. So yeah, he'll come in. It'll be a Saturday. He says he has to come in on a Saturday.
I can't wait to hear that. I'd love to hear him on the mic too.
Yeah, you can go back and tell him good stuff. So we always kick the show off with tell us about yourself using only 5 words, and you chose a phrase to describe you that also had some tension to it. So I'm interested in.
I'm laid back and born to heal.
So what do you mean by laid back and then born to heal? Because you also had said driven, and I think that those are synonymous words.
Yes, correct. I just figured born was a little bit better than driven, but
I like that.
I do feel like I'm doing what I was meant to do.
Mm-hmm.
And laid back is just how I've always been my entire life. I'm actually a Libra, so I'm just kind of even keel, and I just kind of go with the flow. I don't try to get myself, too flustered in one direction or the other. I've been a fisherman my whole life. I do a lot of offshore fishing, and that's another way. It just teaches you a lot of patience, and it just kind of everybody always asks, they're like, "You're always so calm." I'm like, "Yeah, just that's how I've always been."
Mm-hmm.
It's an easy way to live.
Yeah. Tell me what date in October?
October 15th.
October 8th on my side.
All right.
Yeah, so we're the same. Yay.
I like it.
Yeah. Very cool. All right. So when you say, I know that there's some metaphors going in there. Born to heal and that fisherman, I'm pretty sure I know we talked a little bit off camera here about faith, but I'm sure that ties into some of your faith too.
Absolutely.
Yeah.
Big Christian my whole life. And
Yeah.
a big believer in Jesus.
Yeah,
So,
I am too. So I usually will front load Jesus girl with a potty mouth. So sometimes those bad words come out, but nah, it gives me grace from those that go, oh, well, you're okay then.
well, we're human, we
Yeah.
sin, and hopefully we can learn from our mistakes.
That is very true. So go ahead and share a little bit about your educational background, the industry of what you're in, alternative health and holistic health, and then also how you got to where you are now. Our listeners love hearing these stories.
So I grew up in Apopka, went to Apopka High School, and I was in the health medical career magnet program. And then I went to UCF after I graduated from high school. Graduated from UCF in 2001 and made the decision to go to chiropractic school. And I started in 02. So graduated, I started in 01 into 01, and then I graduated from chiropractic school up in Minnesota, Bloomington, Minnesota, just outside of Minneapolis, a school called Northwestern Health Sciences University. Great chiropractic college, and graduated from there in 2005. And during all that time, I'd grown up my entire life with chiropractic. So my father was a chiropractor in 1980, started the practice here in downtown Orlando. And it's what, you know, drove me in that direction, just because he was an unbelievable physician, obviously in the alternative care world, but just unbelievable how good of a teacher and good of a physician and good of a caretaker he was for his patients.
Does he still practice?
He doesn't physically see patients anymore, but he still does some consulting work and still works in the office. He still shows up every day pretty much. And he finally leaves me alone after 18 years, but he used to just rag on me all the time.
Oh.
But nonetheless, it's the reason I went through all that schooling and I just stuck with it. And when I graduated in 2005, I was what, 26 years old. So I practiced with him for 3 years, and then he retired from physical practice in 2010, which he was 30 years in at that time. He was kind of beat up. So I continued on, saw a lot of his patients, which was an interesting transition because you figure you had all these patients that saw this guy for 30 years. And I had this conversation today with a patient. They were like, you know, I guess we're going to have to see the kid.
Mhm.
So, I got that judgment early on when I was a young doctor, the son of the guy who started the place in 1980, and just kind of, built it up over time. And we still see a lot of those patients over the last, 30, 40 years. I still, maintain the chiropractic management to a lot of these patients. So,
Yeah.
but it's really cool. Here we are, now today I'm 18, almost 19 years in. So
Mhm.
I love it.
Yeah, one of my friends from down at OMG Labs had told me about Dr. J, and that's how I ended up at your place. And he is also a chiropractor.
He is a funny story. He worked with my sister at ORMC.
Oh,
My
really?
sister was a LPN there, and she worked in the ER, and Jay was a tech, one of the nurses assistants or whatever. And he was exploring his options. And my sister introduced us. Dr. J started coming in when he was still at UCF
Hmm.
and shadowing me 1 day a week on Tuesdays,
Wow.
just on his own time. Found a lot of interest in it. I worked on him. He had never had it done before, chiropractic treatment, and it created a lot of relief for him, and it just kind of opened his eyes. And he ended up going to Palmer and followed, came and joined us and practice. So Jay is like my right hand guy. I think he's great, great
Yeah,
person, great doctor.
he
So
is. Yeah. Palmer College is a really good college,
it
also
is.
in alternative health.
And they opened, I think their first class was like in 2004, and
Wow.
I started school just before that. So nonetheless, I went to Minnesota because my wife's family was up there. Even though her and I met here, we got married, moved up there, lived in Minnesota, which I don't regret at all. I loved it. It was a great change because I'm a Florida boy my whole life. But I just missed the opening of Palmer, which would have been a little bit more convenient. But
Yeah.
nonetheless, things happen for a reason. So,
Yeah. It's pretty cold up there, I imagine.
oh gosh.
Yeah, pretty cold. Not Indiana. You said Indiana,
Yeah,
right?
Minneapolis,
I know
Minnesota.
Minneapolis. Yeah,
Yeah.
I heard that one. But you were born in Indiana?
I was actually born in Iowa when
Iowa.
my
Cold
dad
there.
was getting ready to graduate from Davenport, which was Palmer's main campus, is still is. It's like the fountainhead of chiropractic schools. I was born there. I was 6 months old, I think, when he made the decision to come to Orlando.
Oh, well, you're happy here.
Yeah,
That's for sure.
born there but raised here.
You almost could have been full Floridian. I think that it really counts, though, honestly. You've spent so many
Yeah,
years here. You're like,
I was less
claim
than
it.
1 year old,
Yeah.
so I mean, everybody's like, "You're right." Yeah, I grew up here my whole life, so.
Yeah, yeah, pretty much, yeah. So so you told us a little bit. Let's talk about what Palmer does. I mean, not sorry, not Palmer, but what your business does,
Yeah,
Pavlik.
yeah.
What is it? What are the services that you guys provide?
So we have, including myself, we have 4 chiropractors. We have an acupuncture doctor who is also a licensed chiropractor and has, 25 years of acupuncture in conjunction with the chiropractic care. So we have him, but he only provides the acupuncture services in our office. We have massage therapists, and we have a exercise physiologist that actually will be going to physical therapy school here this summer, and he does a lot of our stretching and our strength training.
Mhm. I've experienced all of these things that you've described,
And
and they've been phenomenal.
we also do a little bit of nutritional work. I'd like to have somebody at some point maybe to do that, but we as doctors, as chiropractors, you know, we learn that through school as well.
Mhm.
So it's definitely one of the major aspects of alternative care as well.
So when people come in there into there's a perception I would say about what is alternative, holistic, care versus Western care? And I know you're going to tie it into what you guys do too. So,
It's basically what we're doing, basically our treatment, and it's not just musculoskeletal, but obviously chiropractors, massage therapists, physical therapists, we're stereotyped to musculoskeletal pain, but we treat people without the use of pharmacologics, medication.
mhm,
So we are trying to find the root of the problem and fix the root of the problem as best we can without invasive procedures, without surgery, without injections, without medication. Not that there's not a time and a place for that stuff. There
mhm,
absolutely is. And we also have a medical provider in our office that we work, hand in hand with. So it's technically an integrated clinic with
mhm,
medical and the alternative side, but there's a time and a place for that medication. But as time goes on, the people that tend to come into our office are looking for more of the non-medicinal approach
mhm.
to treating their musculoskeletal pain. So that's what we believe in, from a standpoint of just, that's traditional like holistic care. You're trying to treat things naturally.
Mhm.
And the stereotypes towards chiropractors, obviously, the number one that's always been there forever and ever is we're not a medical doctor, so we don't necessarily know what we're doing. However, our education, is very similar to that of a
Yeah, it
of a
is.
medical doctor. So we just focus more on, once again, musculoskeletal uh, treatment alternatives. But that's the number one stereotype. Number two, obviously, which is different now because of videos, Instagram, TikTok, all that stuff, is, the popping of the spine and, oh,
Yeah.
you're just cracking my back, you're breaking bones and this and that. And technically, when you do an adjustment to the spine, you're just moving the joints.
Mhm.
So that popping you feel is gas that's releasing from these capsules that are joints
So
that
if
form in the
people
spine.
go and crack their knuckles, that's what
That's air, that's gas coming out of the fluid that,
Wow.
because all of our joints have fluid. That's how they move. So, the muscles move us, but the fluid is what, it's like WD-40, right?
Yeah.
It's what allows us to move. What do you do when you have a rusty door hinge? You spray WD-40 in there and you move it a little bit. It's not squeaking anymore. So without the fluid in our body, that's why dehydration plays such a big role, on the
Mm.
muscles and the joints. If you dehydrate yourself, I mean, it's gonna play a role on your joints as time goes on. So, anyways, the gas is released when you pop or crack, or whether it's on your own or by a chiropractor. I mean, that's kind of a natural thing for the body to do. We just do it as specific as we possibly can. If there's inflammation in a certain area, like in your neck when you get a whiplash injury, we want to target where that inflammation is coming from, and we want to try to relieve that pressure so that the stress comes off of that area. The muscles won't have to guard it as much.
Mhm.
So what happens? You have a crick in your neck, technically the term crick in your neck. You have a stiff neck, whatever. I hear it all, but you can't turn your head very well one direction, right? Well, people are like, is that my muscle doing that? Is that my joint doing that? Is that my disc? Is it bone on bone? It's like, it's the joint gets inflammation. It's just like when a knuckle gets swollen in your finger, right? You can't bend it very well. So when that happens in your neck at one of the segments, guess what your muscles do? They seize up. So
Mhm.
they don't want that motion. Think of the old theory of how to treat back pain way back in the day is like, here, take some of these anti-inflammatories and just go lay on your back for a week and you'll be fine.
Yeah.
Well, that's not the mentality of people anymore. It's like, we have to fix this problem so that I can keep doing what I need to do,
Mhm.
making a living. So, with the adjustment, with the chiropractic treatment, you're helping speed up that healing process a little bit better. You're calming down the musculoskeletal system and getting that person back to 100%.
Hmm.
And then the modalities that we do in the office basically go hand in hand. So you get the person better. They can go into stretching, they can go into exercise training of specific ways to strengthen the muscles of the back, the postural muscles, the core muscles, all that stuff. Stretching is like brushing, and I'll talk about this here in a little bit where I got this
Mm.
analogy from, but stretching is like brushing your teeth. Should be
Mm.
doing it every day, no matter
Mhm.
what. But what motivates people to stretch? Pain,
Yeah.
right? Oh, I tried to stretch it out. I was hurting. Well, you should have been stretching already. And then you got the massage therapy aspect, and there's different aspects of massage. You've got, your hands on different types of massage. There's lighter massage, deeper tissue massage. You've got cupping. You've got what's called Graston, which is like a scraping technique to
I
break up
saw
scar tissue.
that.
Yeah, you can do all these things.
But let's go back to cupping because
Yeah,
I some of my listeners will not know that. And I know that I had that treated also and I went, "Wow." Because I could feel, well, I know you'll explain it, but the way that one of your technicians had said is, we've got to be able to pull the blood through the muscles to be able to get them to, kind of not be so
yeah,
hard like a
correct.
brick.
We try to keep things in simple terms so people understand it. It's got to make sense. But this, not trying to be disgusting and all, but it's like a hickey, right?
Yeah.
What happens? The blood comes to the surface, it creates a red mark or what looks like a bruise. Well, the suction of the cups, and there's a few ways to do cupping. There's suction, just pure suction, just pulling the air out, and it pulls the skin up into the cups, and the cups just hold on right in that area.
Mm-hmm.
You find the spots where the trigger points are, which are just basically built up areas of lactic acid and what I call stagnant blood.
Mm-hmm.
It's just not circulating well because it's always tight. Classic, right up in your shoulders. When you
Mm-hmm.
shrug your shoulders, everybody's always rubbing that area, right?
Mm-hmm.
That's a classic area that'll build up. So we put the cups on that area. There's another way to do it, which we don't do it this way, but traditional acupuncturists like oriental medicine specialists will do it this way is they use glass cups and fire. They heat up the cups
Oh,
and then the heat pulls the skin into the cups.
wow.
So it's the same theory, it's just different presentation. And possibly a little bit different outcome either way, but both ways get good outcomes, but it's pulling the blood out of the not and I got to make this sound as simple as I can, but it's just trying to draw some of that stagnant blood out of that deep muscle tissue.
Mm-hmm.
But the blood doesn't come out of the skin.
No.
It comes to the surface and it creates that red mark. In my case, when Dr. J does it to me, they get purple as this mat
Wow.
right here. I mean, some people just get redness. I mean, in me, it looks like a true bruise. So some people will get like that, but I go kind of intense and you got to gauge the person on what they can tolerate. But
Mm-hmm.
I love it. It relieves my tension. It's a 10 to 15 minute. We leave the cups on. You just lay there. Some people fall asleep. It's obviously the idea is to relax and breathe and try to get the body to calm down a little bit while this is happening. And it creates great results, in my
Oh
opinion.
yeah. I noticed that, like, it was a couple days after I had been like stretched, and then I also had the cupping with the trigger points, and I went, "Is this what a normal back is supposed to feel like?"
Yeah,
I
ideally,
carry a lot of stress.
ideally. I mean, the thing is though is you gotta like other stereotypes is like, well, do I have to get adjusted all the time once I see a chiropractor? And the answer is no. But ideally, if it helps you,
Mm-hmm.
why would you not want to do that every once in a while? It's not doing any harm to your body.
No.
So, at least in the experience that I've had over 44 years, you know what I mean?
Yeah.
But everybody's different. You got to treat everybody different. And, that's how you have to approach, technically any type of medicine or, anything in our world. But everybody is different. So you have to take every individual person and determine what it is that you can and can't do with them.
Mm-hmm.
And oh, by the way, we like to take x-rays. We like to look at the images, the
Yeah.
MRI and the x-ray images to understand what that person is dealing with because the body ages
Mm-hmm.
and it wear and tear over time. We need to see what the extent of that is so that we can help you feel better
Yeah.
consistently.
Yeah. I know that, I've gone to a chiropractor before, and I always had good results, but I've gone and had deep tissue massage, and out of all of the things, and then I was also experiencing stretching. I think stretching was the best thing because I would walk out of there and I would go, "Man, I feel like I'm like, I'm 5'2", but I could say, "I feel like I'm like a ballerina. I'm so nice and straight, and my posture was good and everything." It was
Well,
amazing.
ideally, the physical therapy, stretching aspect has always been a hand in hand service with chiropractic care. The worlds collide a little bit because you get personality and ego issues when from one provider to the other. But when everybody works in the same office, we all work together.
Mhm.
But it's a true complement to an adjustment. You get the joint mobility better. You got to work on the muscle.
Mhm.
So you start stretching that muscle, and people are like, "Oh, I can stretch on my own." And then they do the stretching,
Mhm.
and it's why, places like Stretch Lab and those type of
Yeah.
places have become so popular because people are shocked at how good they feel when they get somebody to stretch them out.
Exactly, and I
It's
have gone to Stretch Lab, and I can tell you it was like I said, I don't wanna go to a gym until I know that I am
Yeah,
actually more mobile
correct.
and I could feel like I could, successfully touch my toes and things like that.
That's what I tell people. I mean, everybody, and I'm speaking for my clinic, everybody works together and they see the same issues. We just approach it different, right? So like they're like, well, I think I want to see one of your massage therapists. And I said, well, I mean, massage therapists are good, but they're going to see everything we see when we say,
Yeah.
I want you to see this person or that person. I want you to see Derek for stretching. They see all the same problems. So
Mhm.
we all have the same goal of helping that person, but we all understand that person as well
Mhm.
equally. So the results, knock on wood, tend to be pretty good.
Yeah.
So
Are there any other myths that are out there about chiropractic care?
oh, there's a lot. Um, the biggest one is just having to be adjusted all the time.
Yeah, you mentioned that
Getting
one.
getting injuries. I mean, you can create strain or stress on a spine if you're too aggressive with a person. But once again, you have to know everything you can about this person, bone density, um, degeneration,
Mhm.
what can we move? What shouldn't we move? But,
Mhm.
a lot of people go to a chiropractor, and it's funny, if you go to a good chiropractor, you tell a person. If you go to a bad chiropractor, you tell everybody.
Yeah.
So, like, therefore, the stigmas of, oh, don't go to a chiropractor, they'll hurt you.
Yeah.
Well, I mean, it's physical in nature.
Yeah, it
So
is.
there's been people that, but I have to be aware of, okay, if I aggravated something in this person, I gotta fix it.
Right.
I gotta get them better. I gotta direct them in the right direction. So I don't hide from that. I don't run from it. It's a challenge. Everything can be a challenge, but yeah,
Mhm.
you just have to address each individual person, their concerns. There's all kinds of concerns out there about chiropractic, but I try to address it as best I can to the person and say, look, let's give it a try. Let's see what you think.
I would imagine some people think, "Gosh, it looks like you're gonna twist their head off."
Yeah,
Yeah.
they watch the old movies,
Yeah.
right? Breaking necks, and this one little kid, 6-year-old kid, never forget this, treat his parents. He comes in, he watches, he loves it. He loves the table and playing with gadgets and stuff. And he started telling people, they're like, "Well, what do you wanna be?" And this was not in the office. This was, like, at a school or something. And he's like, "I wanna be a chiropractor guy." And they're like, "Oh, why you wanna do that?" He's like, "'Cause I wanna snap necks and cash checks." And I'm like, it's like the funniest thing I've ever heard a kid say, but that's obviously a stereotype. You're just snapping people's necks, you're gonna break and but once again, it's about knowing the person, it's about controlling what you do from a
Mhm.
treatment aspect. You gotta know your parameters, and that's the stuff we learn in school. I mean, we
Mhm.
work on each other, and, you know, eh, we are very cautious, very, very nervous and cautious in the beginning, and then you build that confidence up once you start working on people.
Mhm.
And you get people that are braver than others that are like, just go do whatever you got to do. And then you get other people that are like, you're kind of young. I don't know if I want you to mess with me. But there's all kinds of stuff. But yeah, they watched movies all the time and say,
Mhm.
man, you're just doing what that guy's doing. I'm like, well, technically I'm not, but I get it. It looks like it. So,
Hmm. Hmm.
but yeah, so those are kind of all the things we have to work through all the time.
I've seen people do chiropractic care on dogs and, animals, but dogs in particular. There's a lot of that right now on
Hmm.
YouTube. And I went, is that a thing? I don't know.
Well, it wasn't credentialed in any state, but like Wisconsin and another state when I was in school. Like you could only go to Wisconsin to be a chiropractic, veterinarian or whatever,
Mhm.
animal chiropractor.
Yeah.
And but now it's good to do in all states because people take all their animals. I mean, horses and a lot of horses. People spend a lot of money on their horses and they will do whatever it takes to keep those horses 100%. But dogs are very popular, cats are
Yeah.
popular
I
because
would
they're
think
easy.
cats, it would feel like I'd break them.
No, I mean, they're all
They're like spaghetti
the bone
anyway.
structure is set up the same. It just seems like that, but a dog is just stronger, more
Yeah.
muscular. Cats are just more flexible.
Yeah.
Um,
Very.
but man, there's a guy on Instagram or whatever that I don't know where he is. He might be in another country, but he is unbelievable at adjusting a dog. I mean, it blows me away. It's pretty amazing. He's just very good at what he does,
Hmm.
and it's cool. So yeah, I mean it can be done
Yeah.
on
And
anything
people will pay for that.
with a backbone.
Yeah.
But yeah, people. I had a patient one time that brought his daughter in. She was a horse rider, and she was very competitive. Well, the horse fell one day jumping over something and she crashed with it. And she was complaining about certain things, but the horse wasn't right. So the parents took the horse to the vet. They took it to the chiropractor. They're getting adjusted all the time. They're spending all this money on treatment as the younger lady was complaining about back pain. And he said, I'm spending all this money on my horse. I may need to pay attention to my daughter. So he finally brought her in to see me. So it's
Crazy.
just kind of funny.
It is funny. It absolutely is funny. So when we talk about anything else in that holistic or the Western side of medicine, personally, I feel like I was surprised. I read everything in your offices, and in your offices, you guys have a body with just the bones, and then a body with the muscles, and then the body with the I guess
Nervous system.
nervous system. That
Yeah.
was it.
So the nervous system is encased and protected by the bone structure, and then the muscles attached to the outside of the bone structure because the muscles are what move us.
Mm-hmm.
But they all three play a huge role in what it is that we do because people get pinched nerves all the
Mm-hmm.
time. And that pinched nerve comes from a structural issue, could be structural, could be soft tissue, both of which we can try to work on.
Mm-hmm.
And yeah, those are the three main systems that we focus on. And that nervous system is tied to absolutely everything that functions in our body. The brain is the main computer and it has all its nerve branches that tell everything what to do. It tells the heart to beat, tells the stomach to digest, it tells the glands to release hormones. It's unbelievable what our body does.
Right?
And it's all controlled
It's
by that nervous
incredible.
system.
Yeah, I totally get it. So I feel like when people come into the office and they see that, they can see, oh, wow, there's a lot that's going on here. But I remember reading on like a lot of insurances don't cover this, any type of care. So,
Well, insurance is tricky. Like we've always been on the health insurance panels, and they've covered chiropractic for a long time. We fall under the specialist copay,
mhm,
and whether it's a deductible or a copay, but we accept most insurances. It's just insurances only pay for certain things that a chiropractor does.
mhm.
For example, Medicare, they only pay for the manipulation. They don't even pay for the initial office visit. They're like, we just pay for the manipulation. It's like, so what am I supposed to do? Just walk in on the pay, not ask them any questions and just adjust them,
Yeah,
so we have to do an exam, an initial exam, which takes time. We do x-rays. Medicare doesn't pay for that because only the PCP can order the x-rays on a Medicare
right.
patient. But everything to a Medicare patient outside of the manipulation, outside of the adjustment, is out of pocket to a
Wow.
Medicare patient. But United Healthcare, Blue Cross or Florida Blue, Cigna, Aetna, they pay for the majority of the things we do in our office, minus acupuncture and massage.
Very
Massage and
nice.
acupuncture are just straight. They used to, They never paid for acupuncture, but they really lowball an acupuncturist. I mean, it's not even worth it. Like, it's crazy.
Do they do cupping?
Yeah, it falls well, not
Not as
not
that
a lot.
defined as that.
If the doctor does the cupping, which I do, then it falls under myofascial release. We can bill it because we're licensed and credentialed with those insurance companies. But the massage therapists, if they're not credentialed, they won't pay for it, which they're credentialed through me. But all the
Mhm.
insurance companies make us jump through all these hoops and all this paperwork, and it bogs you down.
Yeah.
So would you rather spend your time seeing patients, or would you rather spend your time doing all this paperwork? And everybody's going to say seeing patients. So therefore, certain things just aren't covered because it doesn't make sense.
Yeah.
So, but yeah, I mean, it has been a covered chiropractic manipulation has been a covered service for quite a long time.
That's good to hear too,
Yeah.
because, sometimes things that fall into preventative care or even maintenance, if it's not a drug,
Yeah.
then,
Yeah.
it's like, why?
It's very interesting. Like, and the new thing is regenerative care that some doctors are doing. They don't cover that either. But what are you trying to do? You're trying to
Yeah.
make the person healthier for the future. You're trying, it just doesn't. I heard the other day on a video on a seminar I was watching. It's healthcare, like insurance. You look at it as it's not really healthy care. Like, what we're trying to do is considered healthy care, but they only allow so much of it. But then on the other side is the crisis management of all these problems. You
Mhm.
look at all the, like the obesity crisis and all these things that link other issues together. That's, it's a lot of it's crisis care. It's not technically health care, right?
Right.
Not healthy care.
Yeah.
And that's what we want to focus on is trying to keep people healthier. And I feel like the younger generation looks into that much more. They want to take care of themselves a little bit better.
So we were talking about there were 5 areas that you had mentioned, services that are really popular in this, area.
Holistic
Yeah.
alternative world, yeah.
Yeah. So what are those 5, most popular services?
Well, you've got the chiropractic aspect, you've got the physical therapy aspect, you've got the uh, therapeutic massage or massage therapy aspect, you've got the acupuncture, and then you've got the nutrition. Those are kind of the 5 main categories. I mean, psychological as well.
Mhm.
We don't do that per se in our office.
Right.
So technically there's 6, but yeah, you have to look at all those different ways to try to help and treat people. But nutrition gets forgotten about.
So when you say nutrition, is that food or is it supplements? Because
Both.
I have seen so much better, I guess I feel better with supplements, and some people are on the fence with it. They can say, "Oh, it'll take 4 to 6 weeks for it to kick in." I would think that's true to
Yeah,
get
the body
something
has
in
to
there.
develop the receptors for it. It's not as potent as what medication does. It doesn't
Mhm.
just adapt right away. The body, it's different. The medication side, the body right away, boom, it takes an effect. But the longer you're on it, right? Technically, the more the body might not react as well
Right.
to it, or it might have other side effects to it.
Mhm.
Opposite of nutrition. The longer you're on it, the more of a positive effect it can have on the body. It just takes the body time sometimes to recognize that because it's not as potent. But
Mhm.
when it comes to nutrition, once again, nutraceuticals, vitamins,
What is
easy word,
nutraceuticals?
vitamins.
Okay.
So the nutraceutical world is your vitamin world, right?
Okay.
And there's a thousand different types of vitamins, right? To try to treat different problems. However, you want to buy quality vitamins. In this world, you pay for what you get.
Mhm.
If you order a $8 multivitamin, that's a month or 2 month supply. I mean, I'm not gonna go down that rabbit hole, but it's like you're paying for what you get.
Right.
So like you just have to know where your vitamin is coming from. So
Mhm.
like in the chiropractic world, like not only chiropractors, but nutritionists, chiropractors, acupuncturists, they all source it from, good places, good sources. So, where there's research driven behind it and everything. So, But yeah, vitamins, excellent. And then diet as well. Diet plays a huge role, what we put in our body. There's so many processed things out there now. There's so many chemicals and it's hurting us. It's definitely having a negative effect. I mean, look at all the stuff that's going on, all the disease and
Right.
cancer and look at where our food has it used to be there were a lot more farms and natural foods coming. Now it's processed for the masses
Yeah.
and you got to be careful what you buy. And one of the things that really confuses me is I get it, but I don't. Organic food is healthier for you. It's better for you. Why is it more expensive? Why don't they make it more affordable to make people more healthy? You know
Hmm.
what I mean?
Yeah. Monsanto. I'm going to throw them out there. I'll throw them under the bus. I don't have a problem with it.
Yeah.
You
I
know, they're
just
fertilizer. It's like, it's not healthy. It's
it's
not good
not.
for us.
Yeah, and nobody thinks about that. Like it's just crazy. It's every aspect of where we get our food. You just can't. I mean, I love Publix, right? But I don't know where half their stuff comes from or where it's
Mhm.
processed or it's
So
just
you go to farmers markets?
I do.
I do too.
Yeah, I like there's a place near me called Fresh Field Farms and it's all good quality meats and vegetables and farmers markets, you locally sourced foods.
Hmm.
But once again, you got to you got to look for it. You got to search for it. It's not easy, you know what I
No.
mean? It's not like
Surprisingly, you can find a lot of that at Aldi. I am
yeah,
so surprised.
Aldi's a
Trader
great little
Joe's,
place.
Trader Joe's is pretty inexpensive, but Aldi is like a secret that people don't always know about.
Yeah, I agree. 100%.
Mm.
The Aldi's up north, I told you my wife has family in Minnesota. They look like Publix on the inside. It's crazy how nice
Really?
they are. It's unbelievable. And you go to some of them around here and they're,
Oh, you got to
in a
come
few
in with your own boxes and
yeah,
bags and
yeah.
everything.
There's a few skeptical areas that Aldi's in. It's like they're making it difficult for us to get there. But we went to one up there. I was like, oh my gosh, look at this place. And they're
Yeah.
like, oh yeah, this is our main place we go.
Yeah.
But Publix rules the market down here, man.
Oh, it does.
Big time. The
They do.
Southeast, like Georgia, Florida, is I think into South Carolina or Alabama, but it's Publix is just you don't want to mess with. It's
No,
so
no.
funny.
But it is a very good experience to go into Publix. It always,
Oh,
feels
absolutely. They
really,
they know what they're
yeah.
doing.
Whole Foods is nice. Trader Joe's is my favorite. I
Yeah,
like to go
I
there.
do too. I love
Yeah.
all those places.
Fresh Market. I'll throw Fresh Market
Fresh
out there too.
Market, definitely.
Super nice. Super nice to go to also. So, who is your favorite thought leader and why?
My dad, for sure. My dad is just he has some of the best analogies and thoughts. So like it's kind of like when I need mental rehab,
Hmm.
I just talk to him. He calms me down. When I get stressed out, he's very he analyzes things from a whole different perspective and his biggest thing is don't act or don't react, you know act. He's like think about it, calm yourself down, you know try to figure out how we're gonna turn
Solve the problem.
turn lemons into lemonade, right? But he's always got an analogy for everything. Like I told you, the brushing your teeth,
Hmm.
stretching is like brushing your teeth. That's where that came from. Change is the only constant in life is change.
That's
He
true
he
too.
can't, he was telling somebody that. So I mean, all these different things, and that's how I learned and understood chiropractic before I went to school. I knew what it was doing because of how he explained it to people.
Mm.
So his mind is amazing. I feel like he's got like a photographic memory. So it's always like you can ask him questions about all kinds of different things, and he typically has a pretty stout answer for it. So it's
Mhm.
like, dang. But I know, like, he's a speed reader and all that stuff. So we used to go on plane rides when I was a kid, and he would read a book like basically on the plane ride. Like
Whoa.
he's that fat. Like so, I mean, he's learned a lot over the years. He's experienced a lot. He's been through a lot of ups and downs. So he's just a good person to bend the ear and get advice from. So I've learned a lot from him.
Very nice. Well, we're going to take a moment to acknowledge our sponsor, and we'll be right back.
The Intern Whisperer is brought to you by Cat5 Studios, who help you create games and videos for your training and marketing needs that are out of this world. Visit Cat 5 Studios for more information to learn how Cat 5 Studios can help your business. Thank you, Cat 5 Studios.
Now, in the second half of the show, we always talk about the future of jobs, industries, and what will the world look like in 2030. So, do you have an opinion? What do you think? George Jetson, are we flying?
Nah, the technology will continue to improve, but yeah, I don't think we're in the Back to the Future stage of flying cars and jets and all that
They
stuff.
actually have some out there. I've seen them.
Yeah, I
They
mean,
can't turn. They're not very what's the word? Easy to navigate. They can only go like one direction and kind of
well,
very squared.
it's kind of funny because the electric cars were being talked about what 30 years ago
Yeah.
probably, and now we're here, we're there. So yeah, maybe 30 years from now, I don't know, but
Well, don't you think we could have had it back then? But it's like that disrupts jobs, that disrupts the oil industry, everything that we're used to that we've already done.
yeah.
So it's like it when we make one kind of a big change like that, which it was totally doable. I don't know if a lot of people sit there in our political offices wherever, and if they're going, well, if we do this, what is the impact on everything else that we do?
Oh,
Like
I
jobs, for example.
absolutely think that, and it all comes down to the number one driver is money.
Yeah.
Money for them, and then what's gonna make them look better in the eyes of the people. So
Mhm.
if you take away a lot of stuff from them, then yeah, they're not voting
Mhm.
for you. But it's the number one driver is money, but yeah, they have to analyze that stuff and what effect it's gonna have on people.
Mhm.
So now
2030 is not that far. I mean, if we don't count this year and we don't count 2030, it's basically 5 years. Nobody saw COVID coming, right? And overnight, our world changed.
yeah, it did.
So we could have anything that could happen between now and AI was the thing that came right after COVID 2 years later. It's like, oh my gosh, AI, we have to pay attention. And yeah, we do. There was this October 8th, it was my birthday. Jeffrey Hinton, the creator of AI, who also worked for Google, he's called the godfather of it. He created and said, "I wish I had never done this because it can go against us."
Yeah, it's well, you know, when you think about there's been movies made about, robots and
Terminator.
AI. Yeah, absolutely. And
Yeah.
a lot of other different movies in the eyes of, those creators. But I agree. Yeah, man, it's positive, negative, probably a little bit more negative than it is positive because yes, it's gonna take away from people. And what are those people gonna do? I
Mhm.
mean, that's we have a hard enough time, getting finding enough jobs for people as it is, and it's like, okay, now you throw this into the mix. Now what? What are they going to do? So
So it's just this is what I usually say is just because we can, it doesn't mean we should.
correct.
Because not everybody is going to be a programmer. Not everybody has the capability that they can do that. We have people with disabilities, mental, emotional, all kinds of disabilities. If they can't do those jobs, then what happens to them? I like seeing the person at the McDonald's that smiles and says hello. And there's McDonald's that do not have people in them now.
Correct.
You
Yeah,
just go in there.
I noticed that probably a year ago when the McDonald's near us had a big grand opening, and we knew the owner of it, so we went by and saw how cool the screens are and the touch screens, and I'm like, hey, that just took away a few jobs.
Mm-hmm.
I mean, convenience, yes, but people like to see people. I
Mm-hmm. We're
mean,
made for a relationship.
absolutely. It keeps us, it keeps our minds sane.
Mm-hmm.
So, yeah, I don't know. I'm not like skeptical about it per se, but
So you don't think that anything in AI or robots or anything could take away the role of a chiropractor?
I don't think so because of the fact that I just don't think a robot's going to be able to do what we do. I mean, they don't understand pain and emotion and all that kind of stuff that we have to recognize when we are working on somebody.
Hmm.
They're not necessarily, you can set, like, let's say a robot is trying to adjust the patient and you can set the tension, but what if the tension's too much?
Hmm.
And you're hurting people. What if the tension's not heavy enough? And so are they going to be able to feel that?
Hmm.
That's, to me, a human being, hands on. Whether, yeah, you can have a massage or a robot massage you. I mean, we kind of have that now. People have it in their chairs, but it's not nearly the same. I mean, I just don't know how that type of stuff is going to be set up. Same thing, like you have these TVs that that have the person inside of them, the AI inside of them that teaches you these specific exercises, but that's not for everybody. Some people need a person there
I
telling you
do.
exactly what you're doing, right? Oh no, you're doing this, you're doing that. Is a robot going to be able to tell you that? And then, from a standpoint of one of the things it could help us with is when it comes to like the therapeutic modalities, muscle stem and um, laser. You've heard all about cold laser and class 4 lasers and that type of stuff. Yeah, maybe you can set the machine up to where it's like a robot where it has this arm, you plug in the thing, and the person just lays on the table and it goes, the arm comes over and it just does the treatment in the area. Yeah, it could do that. But as far as the perception of depth and, pain that the person feels, I mean, I just don't see that taking the place of what it is that we do best.
Hmm.
So
Yeah. I just sit here and I go, I don't think that every job should be replaced
it shouldn't.
because it goes back to the movie Wally, you know,
Yeah.
the little robot,
Yeah.
everybody, the little dumpling people sitting in the chairs,
Yeah.
like, it's not good.
But then where does that leave us as human
What
beings?
are we going to do?
Exactly. I mean, we got to keep ourselves busy. We got to do stuff.
Yeah.
We got to make money. We got to survive. Like it's going to create chaos.
Hmm. So it kind of goes back to, I'll use this analogy, dogs. Dogs were working animals, and most animals like to, they need mental stimulation also. And so when you teach them how to do things, then they're there to serve, right? They are there. Some animals pick it up easier than others. I don't think cats, I have no hope for cats. I don't think they do anything. But maybe there's a cat out there that does stuff. I don't know.
They're kind of made to be lazy.
I think so, pretty sure. But, people were also, working people. And we also, like you said, have to have mental stimulation, that creativity also is in us. So we could always be somebody that is solving those kind of problems, but we should also be the same kind of people that are going, yeah, but I don't think that's a good idea because, then
Agreed.
who's going to be teaching? I don't need to have a robot teaching me. I need to have a human teaching me how to be human.
Correct.
Yeah.
100%. And it goes for everything. When I go to Home Depot, I I I want the help from a person. Not and it's like, yeah, I can look on my phone and see what aisle something in, but I'd rather have the opinion of the guy
Hmm.
that does this every day that says, what screw should I use if I'm working on my deck, or what should I do this? you know, a robot probably could give you some weird, some long technical answer, but I don't know. That's not the good feel for me. I like speaking to people.
Hmm.
When I go to a restaurant, I want a server. I want to talk to the server. I want to say, "Hey, how you doing? How's your day going?" That's how I am. I like to talk
Yeah.
to people.
Yeah.
But yeah, absolutely. I mean, there's got to be, there will be, there'll be people against it too. But the question is how far is it going to go? Because right now you can write a paper. Did you hear about what they're doing in schools now? Because the AI you can put things into some of these programs. Dr. J told me this. He said you can put keywords into this specific program. It's an app, and it'll write a paper for you.
Oh,
It'll
yeah.
it'll it'll create a paper. So now in the public schools, they have another system that has to combat that has to make sure that this kid didn't write the
Yeah.
paper
It's not a
like that.
plagiarism.
Yeah.
It's not, it's like they really did it.
So
I,
there you go. Your catch 22. It's like, okay, we've created this technology, but now we got to combat the
Yeah,
technology.
yeah. I know when I work with a lot of international students and they'll send something to me, I go, "Okay, but you didn't write this, right?" And they said, "No." And they said, how did I know?" And I said, "Well, first off, you do not use that vocabulary. I've never heard you say any of these words, and because that's just not where you are. That's not how you talk. Doesn't mean they don't know the words. But I said also AI uses a lot of emojis. That's what you're doing. So I know you use emojis. AI does that. I also know that you do not speak to me in using these
Yeah,
words
in
and in
that
this
language.
way.
Yep.
And you should just be happy with the fact that people know that you're unique. You can speak what, 3, 4 languages, and I can only speak one and barely Spanish is, like a
Yeah.
a third
Yeah.
maybe of Spanish.
Yeah.
Yeah.
Yeah. No, I 100%.
Yeah. So I feel like some of the things that we might be seeing in your industry, well, just in healthcare in general, is like X-ray vision goggles that doctors put on, and they can just scan my body and they could see something that's wrong. And instead of having to go in and have an MRI or maybe even, some kind of a X-ray,
That would
X-ray
be
vision.
unbelievably amazing. I'm sure
I bet
within
it's out there.
let's say it's created in the next 5 to 8 years, something of that nature, but the expense tied to that is
Oh
probably
yeah.
going to be
For a
astronomical.
while.
But that would be excellent, to be able to get away from X-rays.
Yeah.
That's what we rely on for specificity of what we're doing, as I
Right.
was talking before. But if there's they've digitized X-rays, so now you don't have to go. I used to have to go into the dark room I'd take the X-rays. You'd have to go into the dark room, put the film in the tank. So now they've digitized it to where you take the X-ray, it goes right onto the computer.
Hmm.
Great. But what can they do better to not expose people so much? Can they create some type of scan overall goggles, where it just does one body scan, or even a computer you stand in front of, or a TV or something, and it just scans everything, and it boom just pops out
You
some
know,
type of imaging.
There's an app. I haven't used it because I also do not believe I should accept all of the terms and conditions of everything out there, because I think we keep chipping away at giving whoever, information about us that
Yeah, the
they don't need to
cookies.
have. Yeah.
Accept.
So, but there is an app. It does a scan of your body, and it can tell you what your body mass is and how long it would take you to get to the weight that you're wanting to do. And it says, this is how long it'll take you. This is what you should do. And it does it like this.
Yeah. So
Yeah.
I mean,
So it's out there.
it is out there in the iPhones now,
Mhm.
or not the iPhones, the iWatches, the digital watches that
Yeah.
link
Apple
to your
Watch, I think,
phone.
right?
Yeah, the Apple Watch. It links to your phone, but they have different variations of that based on the type of phone that you have, or the um, server that, or the company that you use. Um, it tracks your sleep, it tracks your heart rate, it can contact 911 if it thinks you're having a heart attack.
Right.
Like, my buddy was showing me this, it can do an EKG, how accurate it is. I don't know. It seems pretty accurate, but it tracks your REM sleep, like when you're sleeping,
I
if
have
you
one.
have
I
your watch on.
tested it, and I don't use it all the time because I just want the white noise. But I was getting all of these pieces of data about myself, and I went, well, I never thought I snored, but apparently I do.
Yeah. So I mean, all that technology is very, very interesting. I mean, it's pretty wild, and who knows where it goes. I mean, I'm never 100% right about everything. So it's like,
No.
you know, by 2030, who knows? I mean, we could have some crazy stuff out there, but I do like the human aspect. I'm not going to lie. I'm a people person, and I think a lot of people out there are. So I think they probably agree with me.
Hmm. I think so. There's apps that can tell you if you're inclined to have dementia, Alzheimer's, all kinds of stuff that's out there. That Parkinson's. I saw one that's
Mhm.
also doing some predicting if you could possibly be at risk for Parkinson's.
And the cool thing about that is they're making you aware of how to be proactive and
Hmm.
not reactive. Proactive. So I love all these little aspects about things, and I think that's going to definitely improve, and there's going to be a
Yeah.
lot of different positive outcomes from these stuff.
It
These
goes
things.
to what you said earlier, not healthcare, but healthy.
Healthy care,
Yeah.
proactive care, not
Yeah.
reactive care, not crisis care. That's what everybody has to try to understand. I mean, if there's one thing that you hear me say tonight, is just to take better care of your health. You've
Mhm.
got one body to use your entirety of your life. If you had one car to drive, how well would you take care of that car?
Mhm.
Your entire life. You've got one body.
Mhm.
Take care of it. So, be proactive. And you're going to have the tools in the future, as we're talking about, to be able to do that.
Do you see a lot of this type of technology coming into the trade shows that you go to?
Yeah. Every year you see something new, different. Some of it's gimmicky and some of it's effective.
Mhm.
But you're always going to have that. But this laser therapy now is pretty interesting. It's designed to reduce inflammation, and it used to just be kind of more on the surface for tendonitis and things like that, little skin issues. Now it's going deep into into the spine to try to reduce some of these inflammation from these disc problems that people have. And
Mm.
so you see that technology increasing a lot. Like I said, the digital world of imaging, right now they're trying to make it easier on physicians to link into the sites to say, okay, the MRI was done, the x-rays were done here. You can look at it, without having to worry about getting CDs and films and all that kind of stuff. But you see a lot of that, like a lot of people pushing that stuff. But there's a lot of other very cool things too that I just don't do in my clinic, but it's coming. I mean,
Mhm.
there's going to be more and more every year. You're going to see something.
Yeah, I agree. So, best mentoring it. This is our last question. It's so hard to believe. Time flies. What is the best mentoring advice that you would like to share with our listeners?
So I've already talked a lot about my dad. He's just really been a guy that I've looked up to my whole life, let alone, this career. And he's taught me everything when it comes to chiropractic care. I mean, a lot of things, let's just put it that way. When I was first in practice, and you come out of school, anybody coming out of school is confident but unsure,
Mhm.
uncertain, right? So, we've got people walking into our clinic that he's just used to taking care of all the time. And I'm just kind of a little wet behind the ears. And I'm like, okay, I know everything the book taught me to do, but he looked at me, and this was probably day one or day two. He said, look, you've passed all your boards, you've passed your classes, you've got the diploma on the wall, you've learned as much as you can from the book. You have to think outside of the box. In real clinical practice, you have to think outside of the box. That's how you're going to help people and fix people. And it's stayed with me to this day. And I tell people that all the time. So I stand by that statement. And I think if every doctor tries to think outside of the box, I think more patients can benefit from it.
Mm.
But that's,
That's wisdom.
yeah, it is.
Yep.
But like I said, he is unbelievably wise, and I've learned a tremendous amount from him. It's really made my chiropractic career enjoyable because I always have that
Mm.
confidence there that he can help me be better.
Mhm.
So it's really neat.
You think your kids are going to go into this?
So I have a 16-year-old and 13-year-old, and the 13-year-old shows some interest. I don't think the 16-year-old really wants to. She might want some aspect of healthcare, but I don't think that's the route she wants to go down. Very intelligent, but my younger one is much more hands-on. She's very
Mhm.
very street smart, very hands-on, not lazy. I think she would fit in well. The question is, as the biggest roadblock, the biggest eliminator for a lot of people is, do you want to go through all that training and all that
Yeah.
school? But I think if she does, I think she'll be really good.
Oh, that's super cool. Well, how can our listeners contact you? We usually provide website. I found them your social channels off of your website too, but go ahead and tell because this is an audio show as well as a visual show, but how do we find you?
So pavlikchiropractic.com,
You might have to spell your last name.
Pavlik
Okay.
chiropractic.com. It's our clinic is called the Pavlik Center for Health and Wellness. It's just too long of a domain name.
It is.
But pavlikchiropractic.com and Pavlik Health and or Pavlik Chiropractic on our Instagram and our Facebook. pages. Pavlik Center for Health and Wellness on our Facebook page, but Pavlik is the key word, Pavlik.
Yeah.
If you type that in, you're going to find different, we've tried to create as many names as we can to make it easy for people. But the reason we changed it to Pavlik Center for Health and Wellness from Pavlik Chiropractic is just because we do more than just chiropractic.
Yeah, you do.
And we don't want that single stereotype. So,
yeah.
But yeah, it's still our domain name as it's been for 25 years, I think. We've had chiropractic.com. Practice has been around since 1980, but whenever they actually created the website, I think was in 2000, 99, 2000, some of that nature, 98, I don't know. But pavlikchiropractic.com was the original domain name that we got.
Well, and we also give your LinkedIn. So you said you're going to be more active on LinkedIn.
I'm going to do better.
Okay. That's
based on your motivation. I'm going to do better.
Okay. That sounds good. Well, I want to thank you so much for being on the show. This has been delightful. So we'll be getting Dr. J out here too.
Absolutely. I'd love to listen to him. And I always tell Dr. J, since he was young, I said, hey, let's do a video. Let's do this. Let's do that. And he was always a little hesitant, but he's becoming much more comfortable. So I think, he's going to have a tremendous amount of knowledge as well.
Yeah.
From his perspective.
Oh, he does. He's really, really good. So, thank you so much.
I appreciate it.
Thank you to our sponsor, Cat5 Studios. Our video editor is Max Stein. Our music is by Sophie Lloyd. Visit www.e4c.tech to learn how you can recruit, assess, and improve employee learning and your company culture through DEI skills, hiring, and learning. Become an E4C member today. Mention you listen to the show, and you may get the chance to become a guest on the Intern Whisperer podcast. You can support the Intern Whisperer by sharing, commenting, liking, and subscribing on YouTube or your favorite podcast streaming apps.